Hello, listeners, and welcome back to another segment of the Mercenary Podcast. Today's topic is going to be another news article. It's going to be about insurance. But before we get into today's topic, I would just like to take a moment and say thank you to everyone in 2024 that has subscribed to the channel. It's made me feel like this is a possible thing for me to do, to pursue, and it's been a great year. I know I didn't upload a whole lot in the beginning of the year, but toward the end I've gotten some videos out and I've gotten you guys on the channel. So thank you to each and every one of you that has reached out to support me. With that being said, let's get into today's topic. So this is going to be an opinion piece coming from Dr. Shravani Durbhakula, who is an opinion contributor over at The Hill, and her article is titled "The Deadly Cost of Insurance Denials in America's Healthcare System." Luigi Mangione's alleged killing of United Healthcare CEO Brian Thompson has sent waves through the medical community. This horrific act of violence, while tragic and inexcusable, forces us to confront an uncomfortable reality. Frustration with the unchecked power of publicly traded insurance companies has reached a boiling point for patients and doctors alike. And she's absolutely right. People that need healthcare, that have needed it really bad, that are waiting 3, 4, 5, 6 weeks to go see their doctor, and then waiting another couple months to go see their specialist. When their specialist makes a recommendation and insurance says, well, we're not going to pay for that, you're out of luck. Or you have to go with an older option, as she states in the next paragraph. As a pain management physician, I deeply empathize with the anguish of denied care while my patients desperately seek relief. Insurance companies reject treatments that are evidence-based, cataloging them as unnecessary or experimental. These opaque and unreliable artificial intelligence algorithms to deny care and rely on the medical record notes to contextualize the humanity of my patients. The process of scheduling appeals with insurance representatives or peer reviewers is frequently a time-consuming exercise in futility. Decision-making peers can be individuals without expertise in the relevant medical field, incentivized to deny care. The appeals process can take months, leaving patients to suffer while the clock ticks on their quality of life. Would you be frustrated if you needed as Dr. Durbhakula says, a pain stimulator, which is a proven method of treatment for certain types of pain? There's research to back it, medically necessary, and then your insurance comes back and says, we're not going to get that for you. That would be incredibly frustrating. And who was it? United Healthcare. I saw an article. I very briefly touched on this in my interview with Frank last week. An article that they were using an AI algorithm to just kind of blanket deny claims and to where you'd have to appeal it because, they just hit the deny button and the algorithm's just like deny. And it was something like 90% of claims in 2023 were denied claims. Only 10% were approved, which is pretty brutal when you're relying on your health insurance to help get you the care that you need to take care of yourself and your family. That is kind of inhumane. But our doctor here does go on. Insurers argue that denials are necessary to control costs and prevent overutilization, but when denials become routine, when they disregard medical advice, and when they disproportionately impact vulnerable populations, they cease to be a tool for efficiency and become a mechanism of harm. When a patient qualifies for original Medicare, I am relieved as it is subject to stricter regulatory oversight as compared to private insurers. And yes, she's absolutely right. The original Medicare, not Medicare Advantage, the original Medicare gives you a lot more freedom to get better picks for care as far as what your doctor recommends, which is not what you would expect from a government-funded insurance program. But I digress. Anyway, our doctor here is going to go on to talk about the insurer's unchecked power. And commercial health insurers wield enormous influence, often prioritizing profits over patients. United Healthcare reported over $20 billion in profit in 2023. That's billion with a B. Yet patients continue to face barriers to care. Insurers argue that denials prevent overuse of services, and while there is truth in the fact that medical overspending can result in patient harm while impacting annual economic burden in taxpayers, when cutting costs When cost-cutting trumps medical necessity, the system fails everyone except the shareholders, which is 100% true. It fails every single citizen that is a consumer of American healthcare. It makes it more expensive, it drives up the cost. And how can the cost be getting more expensive when United Healthcare is bringing in more money? That doesn't make sense. What does make sense is the fact that insurance companies don't want to spend their money to cover the things they told you they would cover in the pamphlet that they gave you, the nice shiny brochure, and they're rationing. They're rationing out how much money they're willing to spend, and they have the right to do that because in the contract it says we can deny care for any reason unless it's medically necessary. But they can then say what's medically necessary even though they don't have medical degrees and they don't answer to anyone with their license, which is very disheartening. Dr. Durbhakula gives us a way forward. Recent events are an opportunity for President-elect Trump and the new administration to reevaluate the unchecked power of the commercial insurance industry. We need, number 1, transparency and denials. Number 2, independent review panels. And number 3, national standards. Now let's go through each one of these. Transparency and denials. Insurers must publicly disclose data on claim denials, including reasons and outcomes of appeals, as well as their use of AI to deny claims. Sunlight is the required disinfectant. I think that is a fantastic idea. Every time an insurer hits the deny button on a claim, they need to go ahead and cite a reason why. And they need to have someone sign it with a medical license as to why they don't see it as necessary. And then the specialist that ordered it can go back and kind of crush their hopes and dreams and get it approved because evidence-based care is the way the world works here in America. Independent review panels. I like the idea of that. Independent review panels do sound good on their face, but who's going to pay for it? Is it going to be government funded or is it going to be non-government funded? When it's government funded and the taxpayers are paying for it, A, costs can explode, B, not always the most effective, and C, can be corrupted. Even if it's not paid for by taxpayers, even if it's privately owned, if it's a 501c3, if it's an NGO that has some government funding to take care of this very particular matter, it can still get corrupted. You're going to have to pay people, especially if you're wanting to hire doctors with specialty training in that field. And with how many denials there are, it would be a full-on, full-time job. It would be state to state, and someone had to pay for that, and that would be very, very expensive to pay for doctors to do that. But would it help? Probably. And number 3, national standards. A federal framework for claims and appeals would ensure fairness and consistency, overriding the patchwork of state regulations that currently let insurers exploit loopholes. Here is the problem with that. The National Association of Insurance Commissioners, back in the late 90s, already got together and laid together a framework that they then changed little bits of wording on in their provider agreements and then spread it out to all 50 states with just a little bit of change in the wording. So it's pretty much the same exact agreement in all the states of the United States of America with little tweaks here and there. And so I don't think that a federal framework would necessarily fix it. I think that some federal oversight would be nice, but the problem is insurers have also started to figure out ways of shifting oversight from them to employers that they're selling the plans to. Instead of saying, we're going to pay for care, it's you pay for care and then you have our backing. And that shifts the liability and the care over to the employers. So that's been something that's been happening in the last decade or so. And again, I learned that from reading Frank's book. It's a very interesting read, The Big Lie in My Healthcare Bill. I would highly suggest reading it. But that's going to do it for this article. And I think that Dr. Shravani makes some fantastic points. I think that transparency would be a great idea. I think independent review panels, even though it would be a pain in the ass to get up and running and efficiently run, probably would help in some extent. And then the national standards, I don't know how much the government's going to be able to step in and help fix this unless you give the government even more power, and you know how that works. Well, anyway, that's going to do it for today's episode. I'd like to thank everyone that has subscribed throughout this year for following me and supporting me. Again, your support means everything to me. I would like to remind everyone, if you haven't so far yet, go ahead and drop a like down on this video. Subscribe if you're a new viewer and you like the content so you never miss an upload. And also, go check out the mercenaryshop.com. I put up some new merch on the website. I hope you guys like it, especially if you're in healthcare. I hope you guys get a good kick out of some of it. But that's going to do it. Thank you all for your time, and I'll catch you on the next one.